Hello, I'm Sheila Davies, Director of the Dare County Department of Health and Human Services. I would like to provide you with updated information regarding COVID-19. In North Carolina, there are currently 16,507 cases of COVID-19 in 99 counties. There have been 615 fatalities in North Carolina associated with COVID-19. Currently, the state is reporting 507 hospitalizations across the state from COVID-19 illness. The number of positive COVID-19 tests in Dare County is 22. The most recent case is a Dare County resident. It is unclear how this individual came into contact with the virus, which indicates the potential that the virus was acquired by community spread. This individual is recovering in home isolation. All identified direct contacts of this individual were notified earlier today. Of those 22 Dare County cases, 17 have recovered or are asymptomatically cleared, 1 died, and 4 are active. Of the 4 active, 1 is hospitalized and 3 are recovering in home isolation. For the most up-to-date information on COVID-19 cases in Dare County and the state of North Carolina, visit darenc.com/COVID19. I want to talk for a few minutes today about testing. Testing for COVID-19 is a hot topic at the federal, state, and local level. As we think about testing, I believe it is important to consider how testing for COVID-19 has evolved over the past 2 months. There are several reasons the testing has evolved. First, more is known about the virus, how it spreads, and the various symptoms patients may display. Second, throughout March and April, personal protective equipment, or PPE, was in very limited supply. Global and national shortages of PPE threatened healthcare providers' ability to protect themselves while providing testing. While the PPE supply has improved, we continue to monitor supply and demand and availability. Third, in March and early April, lab companies were working hard to increase their capacity to process and test specimens. In early April, we were waiting sometimes 7 to 10 days to get results back. Now, we get results back in 24 to 72 hours. In addition to the advancements in knowledge, PPE availability, and testing throughput, the testing guidance has encouraged those who were ill but could manage their symptoms from home to stay home for fear of exposing others or themselves unnecessarily. While there is still validity with the exposure concern, ensuring appropriate mitigation measures are used, like wearing face coverings and calling ahead to speak with a healthcare provider, can minimize the risk of spread. Our local healthcare providers have done and continue to do an incredible job with testing individuals who present to their office locations who are in need of testing. We are grateful for the many providers in Dare County who are working tirelessly in our community to care for those with medical needs, including those related to COVID-19. As I mentioned earlier, testing for COVID-19 is a hot topic at the federal, state, and local levels, as it provides data and key information about the spread and severity of disease in communities. I understand there is some frustration and concern in our community about testing availability. I believe this is in part because the messages people are hearing from the federal, state, and local level differ. The message at the federal level is that anyone who needs testing should be tested, and that testing should be free. Unfortunately, that has not trickled down to Dare County at this time. There are some partnerships between the United States Department of Health and Human Services and some major retailers, like Walmart. In a limited number of locations around the nation, the United States Department of Health and Human Services is funding collection sites where free COVID-19 testing is available. As of today, there are 7 Walmart sites in North Carolina offering COVID-19 testing. The closest such site to us in Dare County is at the Walmart in Greenville, North Carolina. Testing at these sites is available by appointment only. More information is available at www.doineedacovid19test.com. At the state level, North Carolina is pushing for increased testing. The North Carolina Department of Health and Human Services has a testing task force that is working on some strategic partnerships to further increase testing availability. We have inquired several times about providing opportunities for free or mass testing in Dare County, but have been informed at this time all of the sites have already been selected. In absence of available federal or state assistance at this time, we have been working to find alternative opportunities. I expect to be able to share more information on a local initiative for COVID-19 drive-through testing by next week. In closing today, I need to stress the most important things you can do to protect yourself, your family, and our community. And that is follow the 3 W's: wear, wait, and wash. Wear a cloth face covering if you will be with other people. Wait 6 feet apart and avoid close contact. And wash your hands often with soap and water for at least 20 seconds or use hand sanitizer. Please also help spread facts, not fear. We encourage you to stay informed by visiting darenc.com/COVID19 or by visiting the CDC or NCDHHS websites. If you have specific needs or questions, you may also call the Dare County COVID-19 Call Center, open Monday through Friday from 8:30 a.m. to 5 p.m. at 252-475-5008. Thank you.